Thank you so much for the opportunity to talk about this research project that I am leading with our wonderful senior scientist, Dr. Goggins, and our amazing research scientist, Courtney Lessel. So, and I guess, yeah, we are sort of sliding over into one of the other CROSH pillars of occupational physiology and the environment. But before we get there, I'm also going to open with just a touch on the human factors pillar. So human factors specialists were excited, I'm going to say, as academics can be, when the media sort of picked up on the Swiss cheese model to try and understand how mitigations can be put in place to protect individuals during the pandemic. So this is the Swiss cheese model, usually attributed to James Reason. And this particular version of it is attributed to Ian McKay. So that is the reference there. But you know, there are personal responsibilities that have been allotted to us. There's shared responsibilities. The idea is that any single mitigation measure is not a piece of cheddar cheese, it's a piece of Swiss cheese, meaning that there are holes in every single one of the measures that you see here that are trying to protect us. But the hope is that those holes in the Swiss cheese never actually line up, meaning that those, in this case, the COVID-19 virus particles aren't actually going to make it to the end to the worker. And so as the pandemic has worn on, many of these mitigations have been removed from us, you know, on a policy basis, on a workplace basis. These things are no longer in place to sort of protect us. And, you know, these, even our personal responsibilities are being reduced due to the lack of continued policies, perhaps in the places that we work and live. And so we're left with sort of very few things that we can actually affect. And this last one that I covered up, ventilation, is the one that we're targeting in this particular project. And so it probably wasn't soon enough in the pandemic that the sort of the powers that be noted that it was transmitted via aerosolized particles. And so we know that now that this is an airborne virus, and because of that, ventilation becomes increasingly important. So it's unfortunate that in our Swiss cheese model, workplaces and policies have not sort of latched on to how important ventilation is going to be. I'm also going to address our hierarchy of controls, which is, you know, another human factors specialist's dream slide here. Of course, with the COVID-19 pandemic, elimination wasn't going to be possible and substitution is not relevant in this case. That leaves us with the three bottom tiers of the hierarchy of controls, which are not usually where you want to have to put your efforts. And so the higher up on this inverted triangle that we can get, sort of the better it is for all people involved. So at the very bottom, we have masks, which is sort of one of the very few last lines of defense that a person can choose to wear, and that remains in effect. The top one here that we have that we can affect, again, is ventilation, and that's what I'm going to be talking a lot about today. And so ventilation and changing the air, cleaning the air, moving the air, however you want to think about it, is an engineering control. And so we're filtering out the contaminants that we don't want to breathe in this case, COVID-19. At the administration level, it's relevant to talk about monitoring, because the tool that we are going to use is sort of going to fall under that, informing people when the air may be unacceptable and when they may want to take additional mitigations to avoid being infected. And so the way that we are going to do that is with this handy little monitor. The one on the screen is sort of the most common one that has come out in the last 3 years, the AeroNet 4. So sometimes I will refer to it as an AeroNet 4. So fairly quickly, this became the preferred device for people to be able to monitor indoor air quality. It was accessible to, you know, ordinary people, not just hygienists or people who routinely measure this in workplaces for their living. And the cost of the units was also reasonable. This one's about $300 It's very easy to use. It runs on AA batteries that last almost forever, I'm going to say. You see that you get some other data there. You get the temperature, the humidity, and there's some other features on it, including an alarm. But you don't have to do anything. It just sits there and actively monitors your space. So for this reason, this is sort of one of the more common ones that's being used. There are cheaper ones on the market that people are now experimenting with, but this is the unit that we had an interest in using in order to allow people to monitor their indoor air quality in a cheap, accessible manner. Now, if we think about why we are wanting to do that, we have to understand that exhaled air, as you can see on this graph, the fraction of carbon dioxide being breathed out is about 4.2%. So occupants inside a room are the main source of CO2. CO2 is not carbon monoxide, just to keep in mind. This is just an inert gas exhaled by a byproduct of living processes. And so if we have CO2 in our space, it has to be removed by some sort of ventilation system. That doesn't necessarily mean a fancy filter. It can actually just mean opening the window, hence my title. A faulty ventilation system, if air is not moving through a building or through a room, you're going to see a buildup of CO2. And that buildup is essentially what is being measured by the AirNet 4 or other CO2 monitors. So the references here for numbers are relevant. Outdoor air is about 400 to 500 parts per million of CO2. And so that's what you could expect outside. And so we've got some other cutoffs happening here. So anything below 1,000 or in the 600 to 800 range, there's not hard numbers on this as scientists are working through sort of what these cutoffs should be. So that would be considered acceptable indoor air. You might have occasional complaints of headache, drowsiness, stuffiness as you start to approach those higher levels. And then we start to flag things over 1,000 as a moderate risk, and then anything over 1,400, or sometimes they say 1,500, would be considered a high risk situation. And so the ASHRAE standard out of the States suggests that CO2 in the indoor air should be less than 700 parts per million. So you see bodies and international standards sort of hovering around that 700 to 800 parts per million mark. And those are where we've sort of placed our understanding of risks. So the risks are well known for the sort of the cognitive difficulties. As soon as you get over a certain amount, cognitive difficulties, they start to present themselves. And there are less known or less well-established effects on kidney function, bone density that may occur if you are routinely exposed to very high levels of CO2. And so in the pandemic, the carbon dioxide has become sort of a proxy for risk of infection. And so, it essentially tells us how much of the air in your room is rebreathed air that's already been breathed out by someone else. And just the thought of it maybe makes you want to, open the window. On Twitter, we see people now starting to carry around these little units and essentially call out organizations if they have particularly high values. So you'll see people carrying these on flights and tagging Air Canada that the values are unacceptably high. You also see people using them on buses, which is another location where CO2 can be quite high if there aren't rooms being open. So this is sort of at a personal level. We see them being used. We see people maybe making informed choices about where they spend their time. Here's another level of monitoring CO2 as a proxy for infection risk. And these are actually now businesses that are advertising that they have quite good values of CO2. So the Apricot Tree Cafe in Southern Ontario has been doing this for quite a while. They have HEPA filters in their space as well, but they routinely post how low their CO2 values are to encourage diners to come and dine in a safe dining room experience. And we've got a physician advertising how low his indoor options for vaccine uptake are on a routine basis. At a policy level, we are now starting to see that countries are taking this quite seriously. So at a policy level, I believe Belgium was one of the first to pass legislation to require CO2 monitoring in certain indoor public spaces. France has now followed suit, and they have mandated the monitoring of CO2 levels in both schools and daycares. And you can see the wording there, that it will be, there will be a direct reading of the CO2 concentration of the indoor air. And this will be going into effect. Latvia has already been doing this. So at some level, it's starting to catch on that we should be using this to understand how good or bad the indoor air is. Things that get measured usually have attention paid to them, and we'll start to see fixes. So that's sort of the first step in getting to a place of better ventilation, is to monitor what's going on. Our own research scientist has been carrying around one of these devices for quite a while. So Courtney is working on gathering some data from buses. And so you can see a typical day in her life where those CO2 values are falling. And she's able to flag, times the day when she's on the bus, which is sort of the highest scenario for her. Luckily, her workplace has excellent ventilation. So you can see she spends the majority of her day sitting just above what would be considered fresh air. And so it was interesting to see that sometimes it's our own houses that have problems. And so tight building syndrome is real. We've done a really good job at spray foaming all of our crevices and getting rid of ventilation. We don't live in drafty farmhouses anymore, but that means that our CO2 may be lacking. So my monitor's been sitting here. I've been sharing the space with my coworker for most of the day. It's sitting at about 883. That's why I'm feeling a little drowsy. I'm going to crack the window until the end of the presentation, just as a means to see what that's going to do. Now it's quite cold out today, but I've got wool on, so we're okay. There are some limits to monitoring, and I wanted to talk through those. So we know that you could be in a room and your display could be quite good. It could say 450 parts per million. You have a door open, you have a window open. Essentially, you're breathing outdoor air. However, if there's a person with an infection of some sort, and they happen to be sitting right beside you, breathing on you, it's not actually going to matter what that CO2 reading says, because they're basically breathing virus particles right on you. So in that case, the monitor is perhaps giving you confidence in a situation where you shouldn't have confidence that your infection risk is low. So I'm just trying to point out the cases when CO2 monitors aren't always reliable in terms of a proxy for infection risk. The other scenario is this one, where you might be in a room with quite a high CO2 reading, 1,400 parts per million, for instance, and you're thinking this air hasn't been turned over very frequently. If, however, you had a HEPA filter in the room, and sometimes you can see them because they're standalone, other times you can't, but that HEPA filter would be removing virus particles without being able to affect CO2 levels. So that could be a less risky place than initially presumed looking at the CO2 monitor. So generally, the other thing to consider is that these monitors do better at monitoring areas where there are a lot of people. If it's monitoring a really large space with very few people, a low reading again might also be you might not be as confident with the reading matching your infection risk. So there's been a grassroots approach to monitoring, and we wanted to align our research with those efforts. So this is one of the groups, CAVI, Community Access to Ventilation Information, and they have been for quite a while now supporting the public library CO2 monitor lending programs. And these were local libraries that wanted to get CO2 monitors in place so that people could easily get the monitor, bring it into their home or their workplace, and understand what the ventilation situation was like. At the same time, there is a monitoring map of sorts. And so people who have access to these AeroNet 4s and other CO2 monitors can upload information in the public places that they're in to allow other people to make informed decisions about whether those places are, quote unquote, safe enough for them to consider going during a surge in the pandemic. And so we wanted to turn this into research. So of course, we were thinking about the ways that knowledge gets transferred, and we wanted to use some sort of framework to understand how can we empower people to get the knowledge that they need about CO2 and about ventilation in areas where they may be. So our approach is targeting aspects that may not have previously been considered within this framework. But if we look at the LAVIS framework, some of the questions that we think are a little bit novel include the idea of by whom. So by whom is doing this work, and whereas sometimes it's researchers or OHS practitioners imposing some sort of knowledge on the people around them. In this case, we are attempting to have individuals be the generators of the knowledge themselves. And how we're going to do that is sort of in the other category. We do have a traditional printed card, but we're also providing a tool. We're providing a piece of technology, which is generating the knowledge that they need to know. And we're also using science, literally walking them through a science experiment to see, to transmit that knowledge to themselves. And to what effect, we are trying to affect the knowledge gain and the intent to change their practice in terms of whether, if they understand that a public space has good or bad ventilation, that might change how they approach that scenario. And so here's our traditional KTE material. We have packaged this very simple card into the units that we are preparing to be able to be borrowed from the library by members of the community. And they can take those wherever they want. Obviously, they have a 1-week rental on them from the library. So they might take them into their home. They might take them into their workplace to check out what the ventilation is like where they're working. So we have this card. It's just a very small front and back. But on the back side of the card, it links them to this science experiment. And so the hope is that people will scan that and then walk through that experiment. And the experiment has been modeled after the same experience that the research team had when they had the units in their own home. And so the interesting thing that all of us experienced when we had the units in our home is that fairly quickly we saw, as I noted before, that the ventilation may not necessarily be as good as you think it is in new homes these days. And so you see a fairly high reading. We walked people through what happens if you bring more people into a room, and more people generate more CO2 molecules, and that measures usually a higher reading. We then asked them to open a window or open a door. I'm sad to say I haven't cracked my window enough. My monitor is still showing about 800. I'm going to have to let a little bit more fresh air in here today. The next thing we do is that we have the person go to a larger room and look at what happens with the value on the CO2 monitor. Typically moving into a larger room, especially if there's only one person, is essentially dilution ventilation, and the effect would be to see a lower CO2 value. But then we have the person do some exercise. When they're doing exercise, they're breathing out more CO2, heavier breathing generates usually a higher value. After we've walked our participants through this experiment with opening and closing the window, moving around, doing more exercise, then we ask them some questions. And we just have preliminary data at this point that we wanted to share. Our first piece of preliminary data is that there's been a big hold on these devices. So we initially had 6 monitors in the Sudbury region. And at one point, I think I saw 23 on hold. So they were all in use. Everyone wanted to know how are they going to get their hands on one of these. We then got additional units so that each library in the region sort of had their own, which was going to reduce the amount of travel time. Sometimes they had to move between libraries before checkouts. But our preliminary data is showing that over the 4 months that we've had units in place, they've been checked out 59 times. So we're pretty happy with those numbers so far. We based our decision to go down this route to pursue this based on the Peterborough Library, which is one of the earlier libraries that had these units. And they had it rented 30 times over a 3-month period. So we think we're on track, that people are interested in having access to these units to check out their spaces. Some of the questions, and I'm not looking at numbers here, but after they've gone through the survey, when we've asked them, how much did you learn about CO2 levels and air movement in your home? The majority of individuals are saying, between 3 and 5, they learned a great deal. When we asked them to rate the usefulness of this AirNet for experiment on their understanding of CO2 and airflow, the majority of them are saying that it was very useful. So the actual experiment they're finding is useful. Then we give them a what if, and this is sort of measuring the intent to change behavior. And so we give them a what if. What if you're trying to decide whether you're going to go out to eat at a restaurant? If you are deciding between which restaurants you would choose, how likely are you to adjust your decision based on knowing what their CO2 values are? It's kind of like the Apricot Tree Cafe. And majority of people are indicating that that is very likely that they may take that into account if they knew the CO2 values of a local restaurant. And then we have an open-ended question, which is really getting at, if someone in your home has a known case of COVID-19, what are you going to do to limit spread to other household members? And we're hoping that they understand that the ventilation can help protect everyone in the house. Not everyone has to get sick if one person is sick. And we have a fair number of answers that suggest open the window, which is great news. Some of them are saying stay home. Stay home is not necessarily going to protect your household members, but it will help the community at large. Wearing a mask has also come up a few times, which certainly is protective. But we're happy with the open the window scenario. Okay, opening the window has now dropped my CO2 to 749. We've got a bit of work to do, and I think a cross breeze at this point would be useful. So I'm going to have to go into the other room and create a cross breeze to drop that a little bit further. So the units are currently at the libraries. If you want to borrow one, you can actually now go to any library. They should have one for use. And the link for the survey is pasted right on the AirNet 4, so it's not hard to find. And we look forward to ongoing data collection with this little project. I am willing to take questions at this point if Dr. Dorman wants to moderate that.
Awesome job. Great presentation. There's a couple of questions. I feel like we should qualify though, Alison, the monitors are available in every library in Greater Sudbury, right?
Yes.
If you're joining the conference today outside of Sudbury, you might have to see if your individual area is doing something similar.
This is true.
Okay, sorry, Alison. First question. Providing a CO2 monitor to the public is great, but if you brought it into the workplace, shouldn't the Joint Health and Safety Committee be involved since it's an occupational hygiene test? And a follow-up to that is, will that information be added to the kits? What are your thoughts?
Yeah, I think we started with the library because it was an easy way to get this into the hands of the people who perhaps were wanting to understand their space. Our next target has always been small business, where they may not have a joint health and safety committee to help protect the workers, and that would certainly, empower them to make changes in the workplace or to understand the workplace. But yes, any intervention that involved a bigger company where they wanted to put these monitors into place would require some sort of collective effort at union level and joint health and safety committee, keeping in mind that bigger companies like that will have more advanced ventilation systems that only a hygienist would be able to sort of evaluate what the actual scenarios are. So this, the niche for this certainly is personal personal use and potentially small business.
That makes sense. Okay, one of our students wants to know if you've measured the CO2 levels in the Laurentian gym.
Oh, I have not.
Certainly in the Ben Avery building.
I've taken, so on that Raven Air map, I have taken and recorded a few measurements. The Fraser Auditorium is wonderfully ventilated. I think it's probably just leaking in general. So it's almost like fresh air over there, even with a full classroom. The Ben Avery building is also good. Those are the places I've been so far with Monitor.
Okay, well, we'll send Courtney. That's from Willa. So Willa, follow up with Courtney. She'll take a monitor over there for you. Okay, are there any concerns with people not understanding the risk? So for example, a worker evacuate meeting rooms at 1100 ppm, believing they were in the immediate life and death situation. Okay, sorry. Oh, so a worker evacuates a meeting room at 1100 ppm. So I assume they're talking CO2.
Yeah.
So do you think there's concern that people will, I guess, interpret high risk with the monitor?
Yeah, I think the messaging around the levels does have to be somewhat nuanced and a bit careful. Am I going to jump out of a room as soon as it hits 1100? No. Am I going to try and open a window? Probably. So yeah, I don't know if I've answered that, but.
Well, I guess maybe a different way to turn it on its head is, have you had any feedback from anybody that they've been more afraid, I guess?
Yeah, certainly. Well, we haven't received any feedback via the survey that people are that they're scared about their CO2 readings that they've observed.
Okay.
But yeah, I think, you know, it's like any of the more accessible information that you can get from wearables and technology these days. It gives you information that can help you advocate for changes.
Yeah, agree.